Diabetes mellitus, often simply referred to as diabetes, is a chronic metabolic disorder affecting millions globally that occurs when the body cannot properly regulate blood sugar, glucose, levels, leading to hyperglycemia, high blood sugar. This condition primarily results from issues with insulin production or how the body uses insulin. While diabetes can seem complex, understanding its types, causes, medications, and lifestyle adjustments is essential for effective management and prevention. Types of diabetes. Type 1 versus Type 2. Type 1 diabetes. Type 1 diabetes is an autoimmune condition. The body's immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. As a result, little to no insulin is produced and glucose cannot enter cells to be used as energy. This condition is typically diagnosed in childhood or adolescence, but can develop at any age. Type 1 diabetes requires lifelong insulin therapy to regulate blood sugar levels. Symptoms tend to appear suddenly and include frequent urination, extreme thirst, weight loss, and fatigue. Unfortunately, there is no known way to prevent Type 1 diabetes. Type 2 diabetes. Type 2 diabetes, the most common form, develops gradually over time and is closely linked to lifestyle factors such as poor diet, physical inactivity, and obesity. In Type 2 diabetes, the body either becomes resistant to insulin or doesn't produce enough to maintain normal glucose levels. Unlike Type 1, Type 2 diabetes can often be managed or even prevented with lifestyle changes. Symptoms include increased thirst, frequent urination, slow-healing wounds, and blurred vision. Though more prevalent in adults, Type 2 diabetes is increasingly seen in children due to rising obesity rates. Key differences. The primary distinctions between Type 1 and Type 2 diabetes lie in their causes, onset, and management. Type 1 diabetes is an autoimmune disorder where the immune system destroys insulin-producing cells, leading to a complete lack of insulin. This form of diabetes typically has a sudden onset and requires lifelong insulin therapy. In contrast, Type 2 diabetes is often the result of lifestyle factors combined with genetic predisposition. It develops gradually as the body becomes resistant to insulin or fails to produce enough of it. While Type 1 is unpreventable, Type 2 diabetes can often be managed or even prevented through diet, exercise, and medication. These key differences highlight the importance of tailored approaches to treatment and care for each type. How do people get diabetes? The likelihood of developing diabetes depends on a combination of genetic and environmental factors, varying by type. Type 1 diabetes causes. Type 1 diabetes occurs when the immune system mistakenly attacks the insulin-producing beta cells in the pancreas. This autoimmune response is thought to be triggered by genetic factors and environmental influences, such as viral infections. A family history of Type 1 diabetes increases the risk, and certain geographical regions, especially colder climates, have higher prevalence rates. While the exact cause remains unclear, these factors contribute to the development of Type 1 diabetes, making it a complex and multifaceted condition. Type 2 diabetes causes. Type 2 diabetes develops due to a combination of genetic and lifestyle factors. Genetics play a significant role, as having a family history of Type 2 diabetes increases susceptibility. Lifestyle factors, such as a poor diet, physical inactivity, and obesity, are major contributors. Additionally, the risk of Type 2 diabetes rises with age, particularly after 45, though younger individuals are increasingly affected due to changing lifestyles. Certain medical conditions, including high blood pressure, high cholesterol, and polycystic ovary syndrome, PCOS, further elevate the risk. Gestational diabetes, a temporary condition during pregnancy, also increases the likelihood of developing Type 2 diabetes later in life. Medications for managing diabetes. Diabetes management varies depending on the type, severity, and individual needs. Here's a breakdown of available treatments. Type 1 diabetes medications. Insulin therapy is the cornerstone of managing Type 1 diabetes. Rapid-acting insulin is taken before meals to control blood sugar spikes. while long-acting insulin maintains stable glucose levels throughout the day. Intermediate-acting insulin provides blood sugar control for several hours. Insulin is typically administered through injections or pumps, which deliver continuous doses throughout the day. Continuous glucose monitoring (CGM) devices track blood sugar levels in real time, helping users adjust their insulin doses promptly and maintain better overall control. Type 2 diabetes medications. For type 2 diabetes, a range of medications is available to manage blood sugar levels effectively. Oral medications, such as metformin, help reduce glucose production in the liver and enhance insulin sensitivity, while sulfonylureas stimulate the pancreas to release more insulin. DPP-4 inhibitors work by increasing insulin production and decreasing glucose production. Injectable options include GLP-1 receptor agonists, which regulate blood sugar and promote weight loss, and insulin therapy for cases where other medications are insufficient. Additionally, SGLT2 inhibitors lower blood sugar by increasing glucose excretion through urine. Each treatment plan is tailored to the individual, ensuring optimal blood sugar control and minimal side effects. Lifestyle changes to manage diabetes. Effective diabetes management requires more than medication. Lifestyle adjustments play a crucial role in controlling blood sugar levels and preventing complications. 1. Dietary changes. Focus on a balanced diet with whole grains, lean proteins, healthy fats, and plenty of vegetables. Avoid refined carbohydrates, sugary snacks, and beverages that cause blood sugar spikes. Monitor portion sizes to avoid overeating and maintain consistent carbohydrate intake. 2. Regular exercise. Engage in at least 150 minutes of moderate aerobic exercise weekly, such as walking, swimming, or cycling. Incorporate strength training to improve insulin sensitivity and build muscle mass. Stay active throughout the day to avoid long periods of sitting. 3. Weight management. Losing even 5 to 10% of body weight significantly improves type 2 diabetes outcomes. Combine healthy eating with physical activity to achieve sustainable weight loss. 4. Stress management. Chronic stress affects blood sugar levels. Techniques such as yoga, meditation, and deep breathing exercises help reduce stress and improve overall well-being. 5. Monitoring blood sugar. Regularly check glucose levels using a glucometer or continuous glucose monitor. Keep a log of readings to identify patterns and adjust treatment plans accordingly. 6. Quit smoking and limit alcohol. Smoking increases the risk of complications like heart disease and nerve damage. Alcohol consumption should be moderate, as it can affect blood sugar levels unpredictably, preventing diabetes complications. Uncontrolled diabetes can lead to serious health issues, including heart disease, kidney damage, nerve damage, and vision problems. Regular checkups with healthcare providers are essential for monitoring and managing the condition. Annual eye exams can help detect diabetic retinopathy early, preventing severe vision loss. Proper foot care is critical to avoiding ulcers and infections, which can lead to more severe complications if left untreated. Additionally, managing blood pressure and cholesterol through a combination of diet, exercise, and medication helps lower the risk of cardiovascular problems, ensuring a healthier long-term outlook. Steps to prevent diabetes. While type 1 diabetes cannot be prevented, the risk of type 2 diabetes can be significantly reduced with proactive measures. Maintaining a healthy weight is a cornerstone of diabetes prevention. Aim for a body mass index, BMI, within the normal range by adopting a balanced diet and engaging in regular physical activity. Exercise, such as brisk walking, swimming, or cycling, helps improve insulin sensitivity and supports overall metabolic health. Diet plays a vital role as well. Limiting sugary foods and beverages while focusing on fiber-rich options, such as whole grains, fruits, and vegetables, can stabilize blood sugar levels and prevent excessive weight gain. Regular health screenings are equally essential, particularly for those with a family history of diabetes or other risk factors. Early detection of prediabetes allows for timely intervention, often preventing progression to type 2 diabetes. Chronic stress also contributes to the development of insulin resistance, which can increase the risk of type 2 diabetes. Adopting stress management practices such as mindfulness meditation, yoga, or regular relaxation techniques can significantly reduce this risk. Combining these habits with consistent hydration and quality sleep ensures that the body operates at its optimal capacity, further decreasing susceptibility to diabetes. Together, these strategies form a comprehensive plan to reduce the likelihood of developing type 2 diabetes and promote long-term health. Innovations in diabetes care. Advancements in technology and research are continually improving diabetes management. Artificial pancreas systems, which combine continuous glucose monitors with insulin pumps, have automated blood sugar regulation, reducing the burden on patients. Smart insulin pens have made tracking doses and receiving reminders more accessible through connected apps, enhancing adherence to treatment plans. Research into stem cell therapy offers hope for type 1 diabetes by regenerating insulin-producing cells, potentially providing a long-term solution. Additionally, wearable technology, such as fitness trackers and advanced CGMs, empowers individuals to monitor their health metrics in real time, enabling proactive diabetes management and fostering better outcomes. Thank you for learning about diabetes prevention and treatments with us. If you found this video helpful, please like and share it with others who might benefit. Don't forget to subscribe for more healthy tips. Let us know your thoughts or experiences in the comments below.